Hi, I'm Dr. Matthew Weiner from the Pound to Cure Weight Loss Center in Tucson, Arizona. And today I'm going to go over very quickly how I discuss the two most commonly performed bariatric surgeries, the gastric sleeve and the gastric bypass, how I discuss this and go over the differences when I'm talking to patients. So when we first talk about the gastric sleeve, it's important to understand anatomically what's happening. We're removing 2/3 of the stomach. People will talk about 2/3, 80%. To be honest with you, most of us do this in a pretty similar fashion, using a pretty similar size bougie so that we can tailor the size of the stomach. And so this makes this a very irreversible surgery. When I do this surgery, it takes about 45 minutes. Most patients have a 1% serious complication rate. You'll typically spend one night in the hospital, although outpatient surgery is certainly very reasonable. And it is about a 1 to 2 week recovery. Really not a major recovery. Most people do very well from the surgery, back on their feet within literally hours, and either home that same day or early the next day with a very modest amount of pain, maybe taking a few pain pills if they take that at all. There's two major issues with the sleeve that I think are really important for anyone considering the surgery. The first is heartburn. I personally do an endoscopy where I put a camera in and look at all of my patients' esophaguses, looking for a hiatal hernia where the stomach's going up into the chest, or significant esophagitis or signs of acid reflux. If you already have significant acid reflux, I would be very careful choosing this procedure. We'll see around 5% of all sleeve patients develop such severe acid reflux after surgery that we have to convert them over to a gastric bypass. 95% of the patients do great, 5% develop severe acid reflux. The second issue is weight regain, and we will see a very substantial number of patients regain weight over the long run after a sleeve. Great 1 or 2 year result. By year 3, 4, 5, we start to see some weight regain, and this can be extremely frustrating. In the past, this was not treatable at all, but now we have weight loss medications, and we found that administering these weight loss medications to treat weight regain after surgery, or just prophylactically to get more weight loss is a great option, and a sleeve in conjunction with medications is a fantastic weight loss surgery option. When we're talking about a gastric bypass, the anatomy of the surgery is a little bit more complex. We divide the stomach into 2 parts, and food will come down the esophagus into a small stomach pouch and then down one loop of intestine, which is connected to the other loop which contains the digestive enzymes. And you essentially create a Y-shaped connection between the small intestines so that food comes down one end, the enzymes come down the other, and they meet down at that Y. This surgery takes about 75 minutes, so a little bit longer than a sleeve, but not much more longer. Has a 2% serious complication rate for most patients. Still one night in the hospital, and I always say 1 to 3 week recovery, indicating that it might be a little bit more of a recovery from a sleeve. But honestly, the difference really is measured in a day or 2 at the most. Gastric bypass patients often are back at work within 1 week after surgery, doing very well. This surgery is a better weight loss surgery than a gastric sleeve. We'll see more durable weight loss, and we'll see more weight loss. Typically about 10% of your total body weight is in addition to a sleeve. So if you're 200 pounds, you would lose 20 more pounds with a gastric bypass than you would with a sleeve gastrectomy. Another really important thing about a gastric bypass is we will see almost complete resolution of any heartburn symptoms because the majority of the acid in the stomach is here, and when we divide the stomach, it just can't get up to the esophagus. It's blocked. And so in patients who have significant acid reflux, this is a fantastic surgery. Some important things and limitations about this surgery is you cannot take any NSAIDs, no Advil, Aleve, ibuprofen, or aspirin after surgery. There's also absolutely, positively no smoking. Vaping is a little more of a complicated decision, but smoking cigarettes after this surgery is strictly prohibited and will create great amounts of discomfort for you and for the surgeon as well, trying to help you out and generally running into a stone wall, because once you smoke after the surgery, you'll develop stomach problems that are very difficult to resolve. There's also a 4% rate of alcoholism. So I counsel all my patients on avoiding alcohol as much as possible, ideally avoiding it completely after the surgery. In my opinion, the only safe amount of alcohol to drink after surgery is no alcohol. Now, sometimes people will ignore me, and I get it. Alcohol is part of our daily life for many people and part of celebrations. And so my second rule, if you're not able to follow that one, is you cannot drink more after surgery than you did before. And you have to be very careful with alcohol to make sure that you don't develop alcoholism. With gastric bypass, we also see something called dumping syndrome. Dumping syndrome is where if you eat fatty, greasy, overly sugary foods, it'll go right through you and create all kinds of GI distress. If you eat healthy foods, we really don't see that same level of distress. You can eat those typically very comfortably. There's a 1% risk of marginal ulcers that form right here between the connection of the stomach and the small intestine. Those are typically caused by smoking, by alcohol use, by the NSAID use, Advil, Aleve, ibuprofen, aspirin. But in a small group of patients, we can see them without any of those risk factors. There is a 3% risk of bowel obstruction, which really sounds terrifying, but for the majority of patients is while not pleasant, is a very manageable condition. You develop significant abdominal pain. I tell all of my gastric bypass patients, I'm your abdominal pain doctor from this point forward. If you have severe abdominal pain, I don't care if it's 5 years, 10 years later, I want to be involved in the decision making. If patients have a bowel obstruction, I can fix this in 20 or 30 minutes and I can have them back at work within a week. It's usually a one-night hospital stay to get this addressed. But the key is prompt and early diagnosis. And then the most common thing we see is iron deficiency. We'll see up to 25% of our patients, particularly women of childbearing age or still menstruating, will develop iron deficiency. And it is important to supplement your iron regularly and to check your iron regularly. If it's low, take a bariatric iron supplement. Those are much more helpful. So I hope this helped differentiate in a fairly quick way the sleeve from the gastric bypass. I've got a lot more videos on my website. We have a fantastic nutrition program for anyone pre-op, post-op, or even non-op using the new GLP-1 medications.